I am Dr. Malik, intensive care specialist. Today, I want to talk about a small topic called malingering. Malingering. We call it, as doctors, we call it functional. Functional. This is functional. Same. Both are same. Medical term is malingering. Common term is functional. Some patients, they come to us with mimicking some disorders. For example, epilepsy, fits, asthma, or unconsciousness. Some people, their symptoms mimic these symptoms. For example, the patient is brought unconscious to the hospital. Suddenly, relatives get a girl or a boy, suddenly she became unconscious or he became unconscious. Now, another presentation is suddenly somebody starts throwing fits-like movements, convulsions, fits-like movements, and he or she is brought to the hospital emergency. Or suddenly somebody develops asthma, or all the symptoms which mimic like original diseases. Almost these are also look like original diseases, but they are not. The patient is not having any disease. It's only a psychological problem which they are manifesting. They must have seen an epileptic, they must have seen an asthmatic patient, they must have seen so many diseases. So when the patient has some psychiatric problem, not psychiatric exactly, some uneasiness in the family. Suppose the boy or the girl is not taken care of, his needs are not being satisfied, he is being neglected or she is being neglected. Sometimes the particular patient will throw symptoms like this. Mainly, I don't exactly say that they are doing it intentionally. They're forced. Their brain forces them to do these things so that they get attention of the family, and particularly the needs which they have, probably they may get, but all those things, as a doctor, I am not supposed to do it. I am not supposed to talk all those things. My thing is, this is the symptoms which for example, a patient comes unconscious, a patient comes with breathlessness, a patient comes with fits-like movements. I just examine them. I will know that these are not the original fits, or these are not fits. It is fits-like movements only. So I examine the patient. Once I know that this is not a real disease, then what I do is I tell the relatives that this is out of anxiety. The patient is like this, don't worry, it will settle down. The patient needs treatment, only thing is for anxiety and other things. We put the patient in a separate room, make the patient comfortable, put a saline or IV line, and give some anti-anxiety medications, etc. At least overnight, we put the patient in the room and make her or him comfortable with the patient's attendant sitting beside them, and ultimately next day morning or by evening the patient will settle down. And next we ask the patient attendants to take care of the patient properly. And another thing is, if possible, take the patient to a psychiatrist, so that if there is a small psychiatric problem, the patient will be on treatment. So we don't see, even if it is functional, it is not to be taken easy, because this can go on repeating like that. It is not a good thing, and definitely it may turn into a psychiatric problem. So the patient has to get a good treatment. Next, we ask the relatives to take care of the patient very well. She deserves care, and she or he deserves care, and the patient has to be taken to a psychiatrist for counseling. Either you counsel at home, or if not possible, take the patient to a psychiatrist. Then there will be something like a family counseling or counseling. That is very good to the patient. But nothing can be taken easily. Don't take things easy. See, even if we know that it is not the original disease, it's only a functional thing, the patient has no original disease, we should not, we are supposed to attend the patient properly, give her anti-anxiety medicines, and ultimately the patient should be treated properly, and the patient's relatives should be counseled properly, so that this condition will not repeat, and if possible, send the patient to a psychiatrist for further counseling. This is what I wanted to tell you, because these cases are also not unusual.